Hello, everybody. My name is Rob Feldman, and I am the owner and CEO of Own2Feet, which is a practice located here in South Florida that specializes in the making of custom foot orthotics. For those of you who don't know what a custom orthotic is or what a podorthist is, I think it's important to sort of give you a definition. So I went into the source for accurate definitions, and that is now these days Wikipedia. So I'm going to go ahead and read that to you and explain to you what these series of videos are going to bring, and let's go from there. So I'm going to read here about what a podorthist does. We are not podiatrists. We do work with podiatrists. We work with orthopedic surgeons, rheumatologists, general practitioners, internists, physiatrists, physical therapists. But here's the actual definition. A podorthist is a professional who has a specialized training in fitting and modifying footwear and employs supportive devices such as orthotics to address the feet and lower limbs. So that is the actual definition. To tell you a little bit about my practice, it's very, very unique, and it's very important to me, and my clients will tell you that I have as a primary objective to bring service back to our clients, because I feel most industries service is lacking. That being said, our practice is designed to actually come to you. We are a mobile practice, and we also will go to, excuse me, your physician's office by schedule and by appointment, and we do work with many physicians and hope to work with more via introduction and actually bring you through our process at your home. Our clients love it, our patients love it, because they have the comfort of their own home. We can talk a little bit more candidly. It's convenient. So it's just been a model that I've deployed for many, many years, and I've had great success with it. Do serve the Tri-County, South Florida area, and that includes as far south as Miami Beach, maybe down as far as Kendall, up to the Jupiter, Stewart area. To tell you a little bit about what we're going to try to accomplish today is just to introduce my practice, which I've done, and to also tell you about what the three-part process of these videos or three videos are going to bring to you. So it's going to be a three-part series. The first part, which I'm going to incorporate into today's video, is introduction of the foot and 3 to 4 basic foot pathologies that I work with very commonly, and I'm very good at trying to bring comfort back and putting the foot back in the primary position. The second video, I'm going to kind of shift gears a little bit, is going to be talking about shoes. And shoes are a very, very important part of the process. And as you remember from the definition of a podorthist, we do work a lot with shoes. And I will instruct you as to what to look for in a shoe, A, B, what some common misconceptions are, and C, what you might be finding in your shoe that might be giving you your foot pain. So we can kind of marry your foot to the orthotic and to the shoe. The third part of the series is going to be the process of how our practice works. So I wanted to just introduce myself and tell you a little bit about the practice, and I'm going to take you right into the actual first segment of the practice and talk a little bit about foot pathology. So of all the patients or clients that I see, plantar fasciitis is numero uno. And it's a very simple, excuse me, it is a very, very simple but painful pathology, and it's very simple to correct given that the pathology has not had a lot of time to develop and become more of a problem. Plantar fasciitis, again, an itis is an inflammation, is heel pain. And the heel pain happens mostly when you get up first thing in the morning and you try to take your first steps. The plantar fascia is a rubber band-like material that will attach here, if you can see the little ink mark there. It will attach at the bottom part of the heel, bottom inside part of the heel, and it will run all the way down the foot and reattach in 4 different areas. The role, I always tell people, is to kind of try to keep the foot together. And give it elasticity so that when you step down, it will flex with the ground surface. What happens with plantar fasciitis, and it can happen with flat feet or high arches, is that we get little tiny micro tears here down at the bottom of the heel. And when we get those micro tears, that's the pain that we feel first thing in the morning until it loosens up. And the reason why we predominantly get micro tears is because if you look at the rear foot, the heel, the top of the heel will tilt in and the bottom of the heel will tilt out, and you can see what is now happening with the actual knee. It's tilting in. So a lot of people that have plantar fasciitis will also have knee pain and ankle pain and even hip pain. So plantar fasciitis, the goal is to stop this area from tearing. Now, one final thought about plantar fasciitis is the fact that people will often say to me, well, that is a bone spur. And the answer to that is yes and no. A bone spur is what we call an artifact. And as the fascia tears away, and they are micro tears, they're not major tears, although they can be, what happens is the body is amazing and the foot is amazing. As we get those little tears, the body will then say that, hey, what we had as an attachment now is no longer a viable attachment, and it will begin to fill in material to replace where that soft tissue was. And that's what we call the bone spur. Usually not the pain that you're feeling. The pain that you're feeling is typically the tearing of the soft tissue. The pain can also not just stay at the heel, it can radiate all along the bottom of the foot. So that's plantar fasciitis. And we will go through ways with the orthotic as to how to correct that. But I just did want to take about 2 to 3 minutes to explain the first pathology.